Welcome to the Academy of General Dentistry podcast series featuring Dr. George Schmidt. Each episode features experts in the field of dentistry who share insights and inspiration to help you succeed. Let's get started.
Hey, welcome back, everyone. We've got a great show for you today as we talk a little practice management with my good friend, Angela Davis Sullivan. Angela, how are you?
I'm good today. How are you doing?
I'm doing great. How are things in South Florida, down in Florida there?
I'm loving the weather after we got over that cold spell. It was a
Uh,
little cold for a little too long.
I'm sure you are. I'm sure you are. Good stuff. Anyway, Angela is a dental practice business and development coach. Angela brings her over 30 years of hands-on experience while helping doctors and teams reach their full potential. Angela is also a speaker and an educator for dental practices. Her background as an administrator, expanded function dental assistant, new patient coordinator, office manager, and advanced training with dental management systems is invaluable with the day-to-day operations in a dental office, with a doctor and with the team. And that's a great background to have, for what you do here, practice management consultant. It's one of my favorite subjects. I really like to talk about this, because here at the AGD, we're really focused in on clinical dentistry, and that is so important. But you got to have the skills, the office skills, the background, the business sense to be able to deliver that and to continue on providing those services for your folks. And I know you happen to go out and, visit offices across the country. So let me start with this. Let me ask you, when you go into an office, when you're going to go in and evaluate, what are some of the first things that you look for? Do you just, is it a case by case? Do you have sort of an algorithm that you check down the list, or what are you looking for?
That's a great question. And a lot of times when doctors reach out to me, they think they know what the problem is. So that's kind of where they point me. And oftentimes it's the team is doing something incorrectly or not the way they think it should have been done. And they just don't know what they don't know about the business side of dentistry. I mean, they went to dental school, become great dentists clinically, and the communication with the team and the patients is where the challenge comes. I look for, team happiness is a big deal because I think when your team is happy, they trust you, they know where you want to go, then they're going to follow you. They're going to ask great questions. They're going to want to level up, or they're going to move out of the way, either by themselves or with help from you to get out of the way so you can follow your dream. In the last year, I will say the biggest focus has been about retaining patients and retaining talent. They've had so much turnover. We have spent so much time interviewing, training, onboarding, moving on, and starting over. It's been a lot of that in 24.
I know retaining talent is a big, big problem across the country in every market. Everyone I know, that's an issue. And I want to circle back and talk to you about that 100%. I think that's really important. But you mentioned something that's also really important, and that is, team happiness. And I think it's oftentimes very difficult for the clinician, the office manager, and so on and so forth, to really be able to step back out of the practice, take a look at that, and see the dynamic that's really going on, right? Because when you're in the trenches day to day and that's all happening, you may not really have the pulse of that. So I think it's important to have folks like you come in and look at that. And how do you deal with that? And how do you deal with maybe the pushback from the staff that's going, "Oh, who's this person in our office and what's she all about?"
Exactly. Yeah, sometimes let's say they don't know what to expect. Like, why is this person coming in? So I always try to have the doctor, office manager, leader, and certainly when I show up to say, look, I'm here as a resource. I'm going to watch you today. I'm going to listen to you. I'm looking for all the things that you already do great and how we can leverage that. And then I'm really good at looking for the gaps. Like, where are you missing something that we could tap into and shift a little bit and you have a better impact? And that impact is good for the doctor, the patient, and for you guys, the team. So I try to come in there with the attitude, I'm not here to tell you that you're terrible at your job. I want to find out what your talent is. Are we using your talent in the right way? What are your strengths? What are your weaknesses? And how do I help you become even more successful in the role you have in the practice? I try to come in pretty like, I want to be your advocate. I want to help you excel at this if you want to excel at it. And sometimes they don't. So
Yeah, and there's a lot of different models. We've had a lot of folks on the program that have talked about practice management and things. And So, is your sort of philosophy or your approach to this that you're going to come in and just watch and see what happens,
Yep.
make some evaluations, and then come back and make some recommendations in terms of what needs to be worked on? Is that is that your approach?
Yeah, that's how I would say. I try to present it as a practice opportunity assessment. So here's all the things I see. Here's all the things that that means. So that's either the good, the bad, the ugly. What does that look like? And if you wanted something different, depending on the goals of the doctor, um, if they can verbalize it and figure out, I want is it, and sometimes it's, I need more new patients, I need more production, I just want my team to be happy and I want to be able to reward them. So then what things do we need to work on? What systems need to be tweaked or created sometimes? And then do we have the right people in the right seat doing what they need to be doing? So then I
Yeah.
present that like a comprehensive treatment plan. Here's your plan.
I've always thought that, as we always say, just like athletes, everybody needs a coach. Some people don't think they need a coach, but I think it's very helpful. What are some things that you can recommend to folks for self-evaluation that would say, hey, you know what, maybe I really do need some help here?
Yeah, I think what a lot of people don't realize is that in the business world, um, the best of the best have coaches. They have business coaches, they have coaches for almost everything that they do, and that's why they're successful. But we only see it in sports. And I'm a huge sports fan, so I can say, yeah, you need a head coach, a quarterback coach, a kicking coach, a defensive coach. You need people who are experts at it, who can back up and look in and see what's happening to the practice, where you might have blinders on or be totally unaware of. You don't even know. A lot of times it happens with the front desk, that business team. I think they're running reports. I think they're doing what they're supposed to do. As doctors, you've never typically done that job, so you don't know. So, how nice to have somebody else come in and help you, like a personal trainer or a tennis coach. They have them in all different walks of life. So, the goal of a coach, I think, or one of my beliefs, is to help you recognize your talent, verbalize what you want, and create paths to help you get there. I don't do the work, but I can help you get on the right path to where you want to actually end up.
Yeah, and I think your background really lends itself to that because you've seen all these different things. A lot of times dentists will say, "I think we need some help here," and so on and so forth, or "We need to get a consultant here." But what percentage of the time would you say where it's the staff where it says, "You know what? Hey, we need to throw the doc a life ring because he's where the ship is sinking." How often does that happen?
It happens quite a lot where the team, um, which I love because if they've worked with coaches in other industries or other practices, they said, we had a coach come in at one time and we didn't like everything, but we liked this. Most of them can find something that they liked. And I think, Doc, this would be great if you brought this in. For a lot of times, it's for the doctors to realize they could be part of the struggle or the problem, and they don't know it. So it's just helping them see that and go, hey, this can be a good practice for everybody. You can feel good. You can not burn out. You can enjoy coming to work with some systems that really help and the right people.
Yeah, I'm glad you mentioned systems because that's where we're going to go in a few minutes. I want to take, you've got a great course that you give, Back to Basics, the Fundamentals for a Thriving Practice. So that's one of the great courses that you give. And I want to pull a couple of things out of there to talk about. And of course, one of the things is systems, and everyone talks about systems. Almost every consultant has that, and it's so important. What would you think are the top three things that really need, you can give me more or even less, but at least try to give me the top three systems that you think it's important to make sure that these are in order to keep the ship afloat.
Yeah, so for doctors, they want their production and collection systems. So what do those look like? What does that mean? One, knowing that they got to produce it. So how do we do that? And if you really look at it, you got to go backwards down that tree to go, okay, if you want to hit a production goal, what does that mean? Where are the new patients? What are we doing with diagnostics? So everything leads to a system just about. Collections, the same thing. If you produce it all day, but you don't have a collection system, and we're really nice and just let people walk out the door, you're not going to be happy either. So those are two huge systems that then branch off to other things that help create and have success in that system. And then it's about retention, keeping the patients that you've already got. So many practices are like, I just need, 40 new patients, 30 new patients, whatever that number is. And I know I could hit that production goal. And then we've got this group right here who've already come to you and loved you that have kind of fallen through the cracks. Like, what do we do to go get the ones we want there first and then kind of go from there? So making sure that that back door is closed at all times for
You know,
that.
I've talked about this with a number of people, and a lot of folks say, I've got to do marketing. I've got to get more people in here. And what they're doing is they got a big open door. It's a real big barnyard door that's open, but the back door is just as big, and they're just going right out the other side. And so not only are they wasting money, but they're just not keeping the
Yeah,
patients, and it's really important. I'm glad you brought that up.
yeah,
Yeah.
absolutely.
You mentioned productivity too. And so I want to ask you about this because, folks always talk about productivity and we want to be productive and things like that. And one of the things you mentioned is a productivity driven schedule. And how do you address that to the doctor and the staff? And how do you get that across without sort of over treatment planning or, looking for too much dentistry, if you will? I'll be kind about that. And how do you try to reach those goals and check that box? What's your
Yeah,
recommendations for that?
that's a good question because um, what one doctor's goal is not going to be the others, and you cannot compare it. You have to figure out, what do you need? What's your goal? What do you want to produce in a day? And you got to be realistic. I mean, if you're not, if you don't have the service mix or the team or the skills to do $10,000 days, that's not really a goal. That's a wish. So let's back up and go, what does your service mix look like? How long does it take you to do things? What is your team helping you do? So are we working to the fullness of our license? So what can your assistants do? What can your hygienists do? And look at all that stuff first and then go, let's set a realistic goal for you and get into a flow where you can meet that. What do you need on your schedule? So if those are the things we need, then we go back and go, okay, so from the new patients, from hygiene, what are we diagnosing? What are we looking for? And you don't have to overdiagnose. I mean, what do you see? Oftentimes, I find doctors see things, but they don't say anything because they don't know how to bring up that conversation and start that conversation. Gosh, I don't know if they can afford a crown or they need that. And they start second guessing and making decisions for the patient on a feeling or what they think they might say or do. So we spend some time on that mindset piece and then we just go, okay, let's create your schedule. What do you like when? Does that meet the goal? All right, great. So that's a $3,000 day for you. How does it feel to do 3,000 a day consistently? Now, what can we do to get to 4,000 a day? And some people want to continue to grow that. Other people go, you know what? If I could routinely hit 5 a day and here's my service mix, I'm happy. And let me train my assistants to do a couple more things here. Then that's golden. But figuring out what that is, creating that schedule, and then getting the team on board with how to schedule to meet that goal, then you look for that consistency in it and do it again and again and again.
I really think the team has to be on board because, as you said, you can approach this when we're talking about treatment planning, especially some of our younger colleagues. I mean, there's a couple ways you can do this, right? It's here, you need all this dental work and it's my way or the highway, or you can, on the other end of the spectrum, you could feel a little guilty about the patient and, they come in and need all this work and so on and forth, so forth. But it's when you can move to the middle, when you've really become sort of a mature practitioner, in my opinion. Would you agree with that?
Oh, I agree. My mentor used to say, you know, my job is to tell you what I see. And I'm going to tell you everything. And I'm going to tell you how I'd fix it if it was in my mouth or somebody in my family's mouth. And we can do this over 4 months or 4 years. But here's the things that you need. And the longer we wait on some of these things, here's the risk of that. And not biopsy somebody's wallet before we decide about their treatment. Let them decide.
Yeah.
Right.
Great advice. Great advice. And you talked about goals. So we're talking about treatment goals, but do you also, when you come in, try to help the practice set other goals, in terms of, you mentioned patient retention. Of course, we're talking about money, but there's other things I think that we can sort of strive towards.
Absolutely. I love to get the team involved in this and as well, because I think when you can involve the team and they can verbalize it, then they got the buy-in. And I know after meeting with the doctor, like where they want to end up. So then my job becomes, how do I get the team to say that without me telling them that's your new goal? So to kind of create that enthusiasm, go, hey, what do you guys want to, what would you want to do? What do you think a good month is? How many of something sometimes can be fun for them? Like fluoride treatments, or it start Invisalign cases, and get them to pay attention to it and track it. Then it becomes fun for them. And we can see, okay, great. Now we're all talking about Invisalign. Wow, we did 5 starts this month. How do we do that? You guys were all talking about it. And then you planted other seeds too. So just getting the team involved for that. And then doctors are like, I don't even have to do all the talking anymore. I know that's the goal. Get them to talk for you.
And I'm sure you're a proponent of morning huddle, weekly meeting,
Oh,
things of that nature.
yeah. I love morning huddle. It's the only part during the day where you guys are truly all together and can focus on. And my goal with huddle is, how are we going to take great care of patients today? How do we need to support each other today? What do we need to do? Where are our opportunities? And then one of the things my team's always looking for is what's next. So everybody that comes in today, this goes to that retention, they're either coming back for their next phase of treatment, or they're coming back for hygiene, and making sure that we've got that back door closed. So if they don't have their hygiene appointment, we talk about it, we make it for them. If they've got their hygiene appointment, we celebrate it, reiterate the importance of it, create the value for it, and say, great, we'll see you in April. Those kind of things.
Yeah. How do you feel about bonuses for the staff?
Good question. I like bonuses. I don't think bonuses are the catch all for everybody. And some people are motivated by money and others are not. Not that anybody would turn it down, but I think my favorite bonus is one that we do with where they have a goal to meet each month, collection wise. I believe the bonuses should always be based on real money, what you've collected. And then we average the collections for 3 months. So 2 months prior and that month. And we come up with an average. And then they get a percentage of that split between the team members based on their number of hours. So it's very fair, I feel like. But there's other ones too. I know hygiene gets some bonuses sometimes when they produce over a certain amount. Though that's great. If they're taking great care of your patients, those are good things. There's flat bonuses. If we collect X, everybody gets $500 or whatever it is. I've seen levels, like, second level would be, everybody gets a gift, and maybe it's like a Coach handbag or something. There's trip bonuses. So there's all kinds of ways to motivate the team, but on a daily or monthly way, I think you have to figure out what each person needs. Because sometimes the biggest motivator for somebody could be, that was a great job on that. That looks fantastic. Thanks for filling my schedule. That was fantastic. It could be words, it could be gifts, it could be, anything. So you got to figure out what that is for each person.
No doubt about it. Yeah, I think I agree with you on that 100%. One of the things I've heard you say, is when we talk about practice managements, it all boils down to streamlined processes, enhanced teamwork, and improved communications. And I've always felt that, when people think about communications, we oftentimes think about projecting things and projecting, but I think listening is a big part of communication. And talk to me a little bit about that.
Listening is the number one thing in communication. We should be talking less and listening more. And we have to listen with the intent to understand it and then take action and answer it. And I would say that a lot of times we're just bad at it. Our brains are going super fast and we're already thinking about how we want to answer. We interrupt too much. Um, we cut people off and think we know where they're going. And so to do that, I think sometimes we get really good at it with our patients. We can listen, but look, you're with each other all day long, 4 days a week at least. You guys have got to learn to communicate effectively and elevate that teamwork. And it's hard to do sometimes. It's really hard to do sometimes, but we got to learn to listen better. So I do talk a lot about listening, the value of listening, how to do it with patients, how to do it with team, so that you can increase that that teamwork and that harmony that you need in practice.
Yeah, we had Joanne Majors on the program going back, and we spoke a lot about listening, and it's so important, you know. And if you think about it, listening really alleviates a lot of assumption. If
Oh,
you
heck
just
yeah.
listen, if you take a minute to take that in before you respond, uh, you're going to be way ahead of the game.
Absolutely. I love that.
I think so. You know, the other thing I wanted to ask you about, uh, a lot of what we talk about has to do with leadership, right? The dentist, although not always, is the leader
Sure.
of the office. Because I've seen a lot of offices that the dentist is not the leader of the office, right? It might
Yeah.
be the office manager, it could be the wife, it could be something else. Who knows what? But um, when we think of leadership, it's different than management, right? Two different things. But a lot of times people get that confused. Managing situations and leading are two different things. So, what's your take on that?
I am a huge leadership fan. Do you ever read John Maxwell? Do you know who
I
he is?
do. Yes, I have.
So yeah, I love John Maxwell. In fact, I love him so much that a few years ago I went and got certified. So I'm also a speaker and trainer and leader in his group as well for John Maxwell. So leadership is very near and dear to my heart. And I've had good leaders and I've had bad leaders, and I've had good managers and bad managers. I've been a good leader and a bad leader and manager as well. And I think it's taken away from all of that and learning that strong people, smart people, people who are invested in your business are going to look for strong leadership. And that can come from the doctor, and it can also come from a team member who might be in that management role. The other thing that's important to realize is you have a leader on your team, whether you know it or not. And they might not even have a title, but they're getting people to follow them. And that's a leader. If people are following them and buying into that, you better hope it's the right stuff, or you've got a bigger problem. And so we work a lot on leadership. I do it a lot with doctors. I do it a lot with the leadership team, whether you're the office manager or you're the business team lead, hygiene lead, assistant lead, all that stuff, because your team is looking at you and you're setting the example. They're carrying your message, ideally for you and with you. So you want that leadership and that ability for them to communicate the message, be the example, lead the way, go the way, do all the things.
And I can't believe you said this because it's so true. And I've seen this where, you know, somebody's the leader and you may or may not know it. And sometimes the leader is not the person that you want the leader to be the leader because you've got people following this person down the road to destruction. So
Exactly.
how do you handle that situation when you go into the office? I mean, how are you going to write that? What are some tips that you can try to mitigate that with? Because that seems, I guess you could fire the person, right? Of course you could do that, but are
Oh,
there other ways to so more tactfully handle
yeah.
that
So,
situation?
and sometimes it does have to be an elimination process. That person has to go. In other areas, it's an opportunity to tap into their ability to lead by helping them find the right direction, which means you, as the owner, because you are the ultimate leader, no matter what, in practice, you're the doctor, you're going to be looked at as the leader, whether you're really leading them or not. They're going to look to you for that. So you've got to have that crucial, tough conversation the minute you figure it out. And sometimes that's uncomfortable. Often it's uncomfortable. Who am I kidding? It's not fun to call somebody in there and go, so here's what I'm hearing and seeing, and I need you to stop. So being able to, one, have the courage to have that conversation, know where you want it to end up, and be okay if that person decides to leave or you have to let them go because of it is another big thing. Because what are we going to do without her? Everybody talks to her, but was it good talk? I don't know. So figuring that out. My best advice is um, have have the tough conversation, have examples of what's happened, and more importantly, have a path to get them out of it so they can help you and lead where you want the practice to go or that system to be taken to the next level, and see if you can get through to them that way. Oftentimes it's really tough, especially if it's been going on for a long time and you are kind of aware of it but don't know the full impact of it. I've seen it where it is detrimental to the practice because the really good hard workers that you love leave.
Yes.
Do an exit interview and they go, well, if Sally wasn't doing that all the time, I probably would have stayed. And then it's like, oh, okay. So we're running good people off because this one has a louder voice sometimes. So don't be afraid to have the conversation, open that conversation. Here's what I need from you. And being crystal clear on that. So you sometimes have to sit down and think, okay, from this person's role, what's the most important thing they do for me? How can I help them do more of that? And get clear with that team member on what you expect, taking the time to do it.
Yeah, I think that goes back even at the simplest form to defining responsibilities and expectations
Yes.
of
Yes.
each and every person in the office, and setting those guardrails so it's easier to manage.
Absolutely.
Yeah, and it goes back to leadership too, right? Sometimes folks are, especially the doctor, maybe, or the dentist. These are tough conversations, and people sometimes just push that off, kick the can down the road. But as you say, the longer you wait to have these conversations, the more destructive and the tougher it is.
Absolutely. Yeah, you've already, by the time that that happens, some relationships in the practice, people who have stayed, have a hard time getting trust back with you and that team member because of the things that have happened or because you've let things slide. And other people are seeing it. And to think they're not is a disservice to you. And you think, does it affect patients? Yeah, it affects patients. They know body language. They can read eye rolls. They can feel the energy in there. So yeah, it has an impact on all of those things, and that's what you want to avoid. And I know it's hard to have those hard conversations. I was not good at them for a long time, but you have to learn how to approach it and just be open to the conversation. And most people, I would say, in my experience, have leveled up or moved on, and that's okay.
Yeah, so a lot of what we just talked about, sort of the interpersonal dynamics between the staff and things of that nature, have a lot to do with what I want to talk to you about because we're running short on time here. Is not patient, is staff retention.
Yeah.
So all of that stuff, I think, if we can manage that properly and have the ability to provide a great work environment, helps in staff retention, right?
Absolutely. Yeah, I think in our world, when we hire somebody, we're already behind the eight ball. We're already stretched thin. It's time to put them in motion and go. And we do that to our new team members. And then we're disappointed and they're frustrated and they either leave or we let them go. And if you back up and go, well, we did a horrible job of onboarding them, they don't know anything about us. We weren't clear on uh, what their job really is. I wasn't clear on my expectations because they had experience as a insurance coordinator or a business team member, or they're an assistant, they're a hygienist. Of course, they know how to do their job, but do they know how to do it the way you want it? Do they integrate with the team? Are you clear on your expectations on what you want? So yeah, really having a strong conversation. I love offices and practices that have a vision statement and a mission, and we know it and we live it. And we have team agreements. So when you join our team, here's our agreements. This is what we as a team agree to. Does that make sense to you? What questions do you have? Can you agree to these? Perfect. Next step, onboarding. I know you're a dental assistant. Here's our expectations. Here's how our doctor wants this, this, and this. Here's our expectations as a assistant team. Does that make sense? Are you on board? And truly onboarding them and giving them every opportunity to be successful. And new team members not looking at any of that stuff as a threat. To go, my job is to help you be successful in this role. What does that look like? So,
Yeah,
yeah,
and
taking
I've always felt the employee handbook is important. I know offices that don't have an employee handbook, but I think that's important.
it
You've got to
is.
have that, and you've got to have that reference to say, "Hey, no, it's right here in the handbook."
Cool. Yep. Yeah, and you should get that the first day. I mean, like the first day, it's some paperwork, and let's review this handbook together. And what questions do you have? And does this make sense? And to make sure you have a good one. And there's people out there that I don't do handbooks. I can see a good one from a bad one, and I'm going to recommend that you go somewhere where we can get a good one.
Yeah,
Make
I think
it
a lot of I think a lot of folks say, I'm just a small practice. It's just me and a couple people here. I don't need a big HR department or HR protocol, if you would. But
right.
HR is HR, and you got to have all that stuff. It doesn't matter how small you are, right?
Correct. You need it at every size. I mean, you need those guidelines and something to go back to. and just to be clear for anybody that joins your team.
No doubt about it. Hey, listen, we're out of time, and I really enjoyed talking about this subject because it's near and dear to my heart. Love practice management. You got so many great things to say, and I know you have a great course, a couple of great courses. Uh, do me a favor and then share your contact information for folks that would like to ask you more questions, pick your brain, hire you to speak.
Absolutely. Yeah. You can find me at Angela at adaptivedentalsolutions.com. You can go to my website there and do a form there to fill out. I'm on Facebook and Instagram. You can find me there. I'm easy to get in contact with. And there is a book on Amazon that I did write a couple years ago now, Coming Home to a Better Practice, which talks about a lot of this stuff. So go check that out too. Got a lot of resources in there for you.
Oh, that's fantastic. Hold that back up again for me.
Yeah,
Great. So coming home, okay, Angela Davis Sullivan, and we can find that on Amazon.
it is on Amazon. Yep.
Oh, that's good stuff. Looking forward.
Yeah.
I didn't know that.
Coming
I'm going to
home.
grab a copy. Yeah,
Yeah, coming home to a better practice.
that's good stuff. Well, thanks so much for coming on. Really appreciate
Thanks.
it.
Appreciate it. Thank you.
Yes, I'd also like to thank our producer, Kristen Gover. If you like what you heard, please like and subscribe to our channel. You can always find us on the AGD app, SoundCloud, Spotify, and Apple Podcasts. If you have any questions, concerns, comments, or suggestions, contact us at news@agd.org. Thanks again, and we'll see you next time.